As you may know, November is National Diabetes Month, a time dedicated to raising awareness about the disease. Dr. Jorge Otañez from TrueCare joins us now to share more about the importance of understanding the condition and recognizing early warning signs. Dr. Otañez, thanks so much for being here.
Good morning. Thank you for having me.
Well, first, if we could talk about how important this month is as far as recognizing and raising awareness of diabetes and how prevalent it is here in the United States.
Yes, most definitely. Diabetes is a chronic disease that affects millions of people throughout the world. Specifically here in the U.S., over 37 million of people are affected by diabetes. And what's actually more concerning is that over 8.5 million of people have diabetes, but they actually don't know they have it. They haven't yet been diagnosed with it. So it's a very, very common disease that we see very, very often.
And one of the things when you talk about having the disease and not knowing it is not recognizing those early warning signs to let you know something's going on. What can people look for? What should they be paying attention to?
Yeah, so it can range from, not having any symptoms at all to having all of a sudden you're urinating a lot, you're a lot more thirsty than you are, you're a lot more hungry than you would be, and there's sometimes some unexpected weight loss. You can feel tired. Those are common symptoms that would prompt you to seek medical care. There's many different tests that you can do to screen, depending on whether you're not having symptoms, or tests that you can actually do if you are having symptoms. So that's where community health centers such as TrueCare come in, and we can take care of those problems.
If you go into your doctor and you just say, maybe it's your yearly physical and you're just there, or maybe you're saying, I'm just kind of feeling off, I'm tired, I mean, who's not? But would this be would this be something that doctors would normally check for, or that would show up in a routine blood test?
Yes, of course. So you can either, sometimes as easy as doing a finger stick. You can have someone do it, and you can right away within 5-10 minutes know the results of your test and know whether you are at risk for developing diabetes or if you actually have diabetes. Yes, you can do a more comprehensive panel of tests and look into other diseases as well. But it's very, very, very easy to identify, and then also very easy to treat once you know you have it as well.
Well, let's talk about some of those treatments. What would those include?
Yeah, so, what's most important when the treatment and prevention of diabetes is ensuring that we have a proper diet and exercise. So this is something that you talk about, sort of like, oh, you should be eating healthier and you should be, paying more attention to the physical activity that you do. But it is the most important thing that you can do to take care of diabetes and also to prevent diabetes as well. So when we talk about working on exercise and eating healthier, there's some recommendations that are out there, such as exercising 150 minutes a week, and then also building up the muscle as well. So it's not just working on cardio, but also building the muscle so you can help bring that blood sugar into the muscles and then other parts of the body. Then the whole thing about the diet, right? So that's something that's very important, that a lot of people have some misconceptions of like, oh, I shouldn't eat things that have fruits that have a lot of sugar, for instance, right? So it's preferably something that you should be doing, eating more fruits and vegetables, as opposed to eating other things that are processed foods and things like that. So it's a little bit different, can be different for everyone. But at TrueCare, we have many clinicians and providers that can help with that and make those decisions what are more important for you and what's going to help you the most.
For people who aren't aware, tell us a little bit about TrueCare. I know the clinics I see them more and more.
Yes, so TrueCare, we have been in the healthcare space for over 50 years. We're a nonprofit community health center with over 23 locations throughout San Diego County and Riverside counties. We offer a variety of services from primary care, adult medicine, pediatrics, women's health, specialty services, acupuncture, behavioral health. We also have some podiatrists with us. So we essentially can help with many healthcare needs throughout the counties of San Diego and Riverside. Our mission is to improve the health status of our communities without, caring about their ability to pay. We see every patient from anywhere they come, and we're able to take care of them. So for those patients who might worry about access to healthcare, we are a place they can come and get that healthcare without worrying about what needs to happen.
All right. Dr. Otañez, thank you so much for the time this morning, and I had to get up a little early, so thank you. Have a great Thanksgiving week.
Thank you for having me.
Well, still to